I've worked in, the state mental health. That's what they were called over there. I know it's an insensitive way of calling it, but they were called mental health hospitals. And not even health. They used to call them mental hospitals, and which today I feel, is not the appropriate way of even naming those hospitals that way. But when I was working in India, I saw that there was a big gap. There was lack of education in the community. There was a huge taboo for anybody who was suffering from any mental health issues. And my heart went for my patients because, they were ignored till the longest. It took a long while for them to come to the hospital to get the care or attention. And even after that, the continuation of the care was a big problem. And then when I moved to United States, I started to learn the system here. There is a much robust system. There are so many options and opportunities for people to get care. But still, what I observed in my journey for last 20-25 years is that there is a big gap for immigrants. Immigrants, they still continue to ignore their mental health as they were doing it back home. And over here, the challenge is even more magnified because here they are in the race of earning, the living or the livelihood for themselves and their families, and they don't have time to think about mental health. They don't have time to think about health, leave alone mental health. Mental health comes even much later for an immigrant, and so all of these observations. Motivated me to continue the passion that I had. And I stuck to the line. I always was in the line of social work. A lot of my friends and colleagues, from my batch, they branched out, they went into business, this, that, and other. But I feel very blessed that I continued my track. And I have been in this field since my, grad school. So, the more I understood the immigrant population here in United States, the more I was getting strong in my mind that this is what I want to do.
And it seems like you've been very passionate about mental health for a long time and have dedicated a huge portion of your career to really trying to get a handle on it, understand it from different perspectives. And in having moved from India to the United States, you also bring a very comparative lens in being able to examine both types of healthcare systems. That's really great. So what, after having all of this knowledge, what really pushed you to start Sahas in 2019?
So I migrated to United States in 2000, and I joined a hospital in New York where I worked. I learned a lot about the healthcare system in United States, which is learned a lot of new things that were not happening in India at that time, like, the abuse reporting, the domestic violence care system that even the hospitals have, the mandatory reporting system, which was not existent at all in India at that time. And so that learning, and then I, transferred to Chicago, where I served a pure psychiatric setup for intensive inpatient psychiatric setup for almost 4.5 years, and got to really practice my book in action. So from there, moved to the obesity area where I worked with the bariatric surgery team. I joined Cincinnati Children's Hospital after that, and understood the connection between the health and mental health, family and mental health. Everything is so interrelated. You cannot pick and choose that I will only focus on this but not that. That was my learning in that posting. And then I branched out to do my second master's in health administration because I started to become more curious about the systems the healthcare system. I got to put my hands on process improvement, quality improvement in the healthcare system. I got to do research. I published my first research paper while I was in Cincinnati Children's Hospital, and got to understand the importance of all of these different other, departments or specializations, in the area of mental health and well-being. From there, when I came to LA, and even while I was in all these other cities, I was always passionate, or what I was missing was also, always comparing that how is it different in South Asian community, or how is it different in India. That comparison always kept me thinking. And so when I was in Cincinnati, I started a group for seniors. When we migrate as people in United States, we don't migrate as individuals. We are such a family oriented community that with us, will come our parents, our cousins, our brothers, our sisters, sometimes as visitors, sometimes eventually they'll just migrate. And especially if you think about parents, eventually they end up migrating because they don't have any option. If people like you and me decide that we are not going back home, what is going to happen to our parents who depend on us, right? And so that migration happens. And so there is this another big section that I observed while I was in Cincinnati. And I saw that this subsection was very, very lonely, very, very aloof, although they were living with their kids, with their sons, daughter in laws, but still they were not assimilated, they were not integrated into the system. They felt like alien till longest. The kids or their sons and daughters, daughter-in-laws were so busy making their life that really they did not have much time for the parents. And so I started to feel really, really bad about that fact. And so I had two other physician friends. One was a geriatrician and one was a psychiatrist. And so three of us met on coffee for several times, and we had this gigantic idea that we need to do something more for the society above and beyond our normal jobs. And we had like big, big, big ideas that we discussed, but really nothing that we put in action till long. And then we decided, let's do something small. And we decided to organize these parents who were there in Cincinnati. And although Cincinnati is a small size, mid-sized city, you will be surprised to know that there are many South Asian immigrant parents who live there. And so we started with a small idea of organizing them in our basements and just calling them for chai and samosas, and give them some safe space to, make their own independent connections. But I mean to say, to our surprise, our first launch, our idea grew big